Hello, thank you for watching the video. Suddenly, do you ever have cold feet or injuries that are hard to heal? A saying goes that people age with their blood vessels. Arteriosclerosis occurs as everyone ages. If a disease occurs when blood vessels are strained due to arteriosclerosis, you might think of myocardial infarction when the heart's blood vessels are strained, or cerebral infarction when the brain's blood vessels are strained. Actually, those two are life-threatening. Arteriosclerosis of the leg blood vessels is a severe disease. The legs are considered the second heart, making them a crucial part of the body. When arteriosclerosis of the legs progresses and blood is not sufficiently delivered from the heart, one day the legs will cry out in pain, and if you can't notice it early at that time, there may be a worst case scenario where you have to amputate your leg. For those who think that arteriosclerosis of the legs is not a big deal, here is some data. The 5-year mortality rate is compared to the average of colon and breast cancer. There is also data that says arteriosclerosis of the legs is high. With that being said, this time we will simply explain how to detect early save our soul signs from the legs and how to prevent arteriosclerosis. We will also introduce a simple way to check if arteriosclerosis of the legs is progressing while watching the video. Please listen until the end. The blood vessels in the legs are divided from a large artery called the aorta into both legs. This is called the femoral artery. The blood vessels in the legs are located farthest from the heart, and as the blood vessels go further, they become thinner. It is said that the places where the blood vessels are thin are prone to arteriosclerosis. When this happens, various symptoms appear because oxygen and nutrients cannot be supplied to the cells of the legs. This is called peripheral artery disease. Peripheral artery disease. Now let's look at the Fontaine classification, which classifies the symptoms that occur when the blood vessels in the legs are damaged from mild to severe. The mildest symptom in the Fontaine classification is coldness or numbness in the legs. As the blood flow in the legs worsens, you may feel cold more easily. However, it is difficult to distinguish between those with cold symptoms and those who feel cold because the air conditioner is too effective. And as the blood flow worsens, symptoms such as numbness in the legs also appear. Compared to the past, it is clearly changing, and that change is intensifying. If you feel something is wrong, it might be a sign that arteriosclerosis is progressing, so please consider visiting a nearby hospital or internal medicine department. Also, many people with diabetes have nerve damage in their legs and have difficulty feeling pain. Such people are prone to late detection and severe symptoms, so please check your legs with the method I will explain now. Please touch your own legs, using both hands from the tips of your toes and slowly moving up. Compare the warmth of both legs. If one side is unusually cold, that could be a sign. In that case, there might be a possibility of arteriosclerosis in the leg. The second stage symptom is called intermittent claudication. It's a difficult name, but it's simple. When you walk, your legs become numb, so you have to take breaks. To walk, you need to use the muscles in your legs, which require a lot of oxygen and nutrients. If you have arteriosclerosis, nutrients can't be transported well, so symptoms appear when you walk because there isn't enough nutrients. The feeling of numbness or pain varies from person to person, but usually after about 5 minutes of walking, numbness or pain appears. And if you rest for about 10 minutes, it gets better. There are many people like that. If a specific joint in your foot hurts, consider a different disease. Also, this intermittent claudication can occur in people with bad backs, not just those with arteriosclerosis in the legs. If the nerves in your back are pinched, you may feel numb while walking and want to rest. The way to distinguish it is simple. Symptoms do not appear when you're moving in a forward-leaning posture, such as when you're riding a bicycle or pushing a shopping cart. If you're like that, it's probably coming from your back. There is a high possibility of intermittent claudication of this type. The reason is that when you lean forward like this, space is created for the nerves in your back, and symptoms often subside. It's a bit complicated, but if you get a diagnosis at a hospital and have an examination, it's easy to understand, so please consider getting a diagnosis. Then, let's confirm the blood flow in the leg. Let me introduce you to a self-check. This image shows the dorsal artery running in the foot, which you can feel by touching it. You can confirm the blood flow. If you can't feel this blood flow, there is a possibility that arteriosclerosis in the foot is progressing. The way to touch it is simple. Just like in this image, raise the bone of the big toe. Please lift it. More importantly, place 2 fingers slightly to the side of the index toe where the pulse of the artery is. If you can feel it throbbing, the blood flow in the foot is being maintained. It's a sign. It's a little difficult if you're not used to it, so just because you can't feel it doesn't necessarily mean there's something wrong. There's a slightly easier place to touch, the posterior tibial artery. Here's a picture. Please try touching a little behind the inner side of your ankle. This is also a place where you can feel the artery throbbing, so if you can't feel this artery, it might mean that arteriosclerosis in your foot is progressing. People with strong muscles or those who are overweight may find it difficult to feel, so it's a good idea to get into the habit of touching it regularly. When you get out of bed in the morning, try touching this artery. If it's getting harder to feel, you might detect abnormalities early. It's important to do this. The third degree of severity of foot arteriosclerosis is pain at rest. This means that it hurts even when you're quiet. The characteristic of this pain is that you don't feel pain when you're living normally during the day, but symptoms appear when you lie down and raise your foot at night. The reason is simple. When you're awake during the day, your foot is down, so blood flow reaches your foot easily due to gravity. However, when you sleep and raise your foot, there's no help from gravity, so blood flow to your foot becomes difficult, making symptoms appear. Therefore, if you have symptoms where it's easier to keep your foot down even when you're sleeping, you might have progressing foot arteriosclerosis. When it was the second stage, symptoms appeared when you were walking and exercising because your foot became oxygen deficient. If arteriosclerosis progresses further, symptoms will appear even when you're quiet. In other words, you could say that your foot is in a state of oxygen deficiency all day. If you leave this state as it is, it may become irreversible and you may have to amputate your foot. Please be careful. If you have these symptoms, please seek medical attention immediately for timely treatment. Please consider visiting a hospital. By the way, in terms of treatment, in many cases, internal medicine treatment or taking medication is performed for the first and second stages. However, if it has progressed to the third stage I mentioned earlier, a bypass surgery is performed, where the part of the foot's blood vessel that has become narrow is bypassed, or a stent is inserted, and by spreading a metal net it is expanded. There are treatments that can be performed. Since it becomes a treatment that puts a burden on the body, it is important to detect it early before it progresses to that stage. So, what kind of symptoms will appear when it progresses to the final stage, the fourth stage? That's where ulcers and necrosis occur. It's kind of scary. That's a scary name, isn't it? An ulcer is something that occurs deep in the skin. It's when the tissue deep in the skin breaks down and becomes hollow. Please look at this picture. Can you see that the tip of the foot is hollowed out? This is what an ulcer looks like. And necrosis, as the kanji suggests, is a state where the tissue has broken down and died. In some cases, the foot may turn black, a condition known as mummification, where it dries out, turns black, and gradually shrinks. If this happens, it means that the tissue in the foot has completely died and is necrotic. On the other hand, there's a chance that bacteria could infect the area, leading to an infection. In such cases, amputation is often necessary. If it progresses to the third stage, you can often tell by the color of the foot. When the blood flow in the foot worsens, what color do you think it becomes? That's right, the redness of the blood disappears, so it turns white. Compare the left and right foot to see if either one has turned white. Make sure to check every day. If several of your toes are very blue and even cold, please consider visiting a hospital. Now, let's move on to the next scary thing. What methods are there to prevent arteriosclerosis in the feet? I will simply introduce something that everyone can start doing from today. The first prevention method is foot care, taking care of your feet. This is not so much about preventing arteriosclerosis in the feet, but rather about preventing serious symptoms that can arise from arteriosclerosis. It's very important. As arteriosclerosis in the feet worsens, blood flow decreases, impairing wound healing. This allows bacteria to invade from minor injuries, causing infections that can spread, leading to severe diseases. Take daily care of your feet. Poor blood flow can cause dryness and cracking. For example, there may be cases where the skin on your feet cracks like this. When this happens, it's easy for bacteria to get in. So please make sure to moisturize areas that are prone to dryness from daily friction. And check to make sure there are no injuries on your feet. The second prevention method for arteriosclerosis in the feet is exercise. In fact, by exercising, you can create what's called collateral circulation, where new blood vessels are formed to bypass and compensate for the ones that have hardened in your feet. This is said to be promoted by exercise. 2 to 5% of people over the age of 70 have advanced arteriosclerosis in their feet. It is said that they have peripheral artery disease, so I would like them to have a habit of exercising to suppress its progression. The second preventive measure is to quit smoking. Smoking significantly increases the risk of leg arteriosclerosis by 3.8 times compared to non-smokers. However, there is also data that gives hope. There is data that says the risk becomes equal for people who have been able to quit smoking for over 20 years and those who have never smoked. Therefore, it is thought that quitting smoking has an effect at any time, so please consider reducing the number of cigarettes or quitting smoking in order to continue walking through life on your own feet. The fourth method of prevention is to prevent diabetes. For those who think there is a relationship between arteriosclerosis of the legs and diabetes. In fact, this diabetes is a well-known risk for arteriosclerosis. As I said earlier, people with diabetes often don't notice the symptoms of arteriosclerosis in their legs because they may have numbness or not feel pain due to diabetic neuropathy. Furthermore, diabetics are susceptible to fungal infections, making foot infections more common. Check your feet daily and keep them moisturized. Let's also pay attention to the early symptoms of diabetes. Regarding the early symptoms of diabetes, the video is listed in the description box and cards, so please take a look. The fifth way to prevent arteriosclerosis in the legs is to get regular checkups. In fact, 40% of people with arteriosclerosis of the legs or peripheral artery disease are asymptomatic. This was mentioned at the video's beginning. In other words, 40% of people don't show any symptoms at all. By the time you notice, it has progressed and early detection is difficult. Therefore, it is important to check your legs daily and have regular checkups when you think something is strange. In the guidelines for peripheral artery disease, it is recommended that people with diabetes, kidney disease, those over 50, and those with a history of smoking over 65 have an ankle-brachial index test once a year. Do you know what an ankle-brachial index test is? The test is simple. Please look at this picture. It compares the blood pressure in both arms and both legs. The test ends in 5 minutes. The blood pressure of each leg is divided by the higher blood pressure of both arms, and the resulting value is the ankle-brachial index. It is said that the blood pressure in the legs is usually higher than that in the arms. However, as arteriosclerosis in the legs progresses, blood flow becomes difficult and the blood pressure in the legs often decreases. If the blood pressure in the legs is higher than that in the arms, the ankle-brachial index exceeds 1 and up to 1.4 is considered normal. By the way, if it exceeds 1.4, it is said to be a sign that the blood vessels are hardening and arteriosclerosis is progressing. If the ankle-brachial index test is less than 1 and if the blood pressure in the legs is lower than that in the arms, it is a sign of arteriosclerosis in the legs. From 0.9 to 1 is a cause for concern, and those who fall below 0.9 are likely to be diagnosed with PA. If the ankle-brachial index test shows abnormalities, we actually use a contrast agent to visualize the blood vessels in the legs. We will examine it using tests such as angiography. How is it? If the blood vessels in the legs are hardened, it means that arteriosclerosis in the legs is progressing. This means that arteriosclerosis of the heart and brain is also progressing. Because the blood vessels are connected throughout the body, it's a matter of course. When you walk, your legs become numb, and when you rest, they get better. There is a test where we gather 100 people with such symptoms, and if we follow them for 5 years, only 5 people had to have their legs amputated. However, out of those 100 people, 30 people died. 75% of those 30 people suffered from diseases of the heart and brain blood vessels, such as myocardial infarction and cerebral infarction. In short, people with advanced arteriosclerosis in their legs also have advanced arteriosclerosis in their heart and brain. Therefore, this leg arteriosclerosis is not just. It can be said that it is important to detect systemic arteriosclerosis at an early stage. Therefore, try touching both legs as introduced in the video, or try touching the blood vessels in your legs, and check the color of your legs and whether there are any injuries. Doing such things is not only to save your legs, but also to prevent diseases that may occur in the future when your blood vessels are strained or broken. And if you talk about the cause of arteriosclerosis, it's high blood pressure and diabetes. We have released a video on how to improve high blood pressure without relying on medication, such as diet. Please view it from the description column. We also have a video on how to detect diabetes early, so please check the description column. So let's review here. The symptoms that appear as arteriosclerosis of the legs progresses are symptoms such as the legs getting cold or numb from light ones, and then the next is intermittent claudication, where numbness or pain in the legs appears when walking and gets better when resting. We introduce such symptoms, and the third stage is a symptom where pain in the legs appears even when silent, especially when lying down at night. And in the final stage, the fourth stage, deep wounds called ulcers appear on the legs. We introduce that the tissue completely dies and turns black, a condition called necrosis. We introduce methods such as checking both feet from the tips, seeing if there's any difference between left and right, looking with your eyes to see if there are any injuries, and regularly checking the blood vessels in your feet, such as the dorsal artery and the posterior tibial artery, to see if there are any changes. And when you think something is strange, you can easily get examined at a hospital by comparing the blood pressure of the arm and the foot, which is called ankle-brachial index. You can screen early. As a treatment method, in the early stages, you may take medicine to thin the blood or lower cholesterol, and if it progresses, you may have to undergo a bypass surgery on the foot, which replaces the blood vessels, or a stent treatment that widens the blood vessels by inserting a wire into the blood vessels. Even after such treatments, if it doesn't improve, there may be no choice but to amputate the foot. It's important to detect and prevent it early. Hospitals, by their nature, incur medical expenses to treat diseases. There is hardly any knowledge about how to prevent diseases. There were times when guidance could not be provided from outside, and even when guidance was provided, it rarely benefited the hospital. However, the most important thing is not to get sick and to be treated, but to prevent getting sick. It's about early detection and prevention before getting sick. At YouTube Medical University, we disseminate information with an easy-to-understand responsibility from the standpoint of active doctors. We would be really happy if you could register for the channel so that you don't miss the next video. And if you have had such symptoms on your feet, or if a doctor has told you this after such treatment, please let us know in the comments, and whether it's a good button or a bad button. We'll use it next if you rate this video. So, see you again. See you in the next video.